In this video, we're going to be looking at how to perform the low bar back squat. This version of the squat is often used by power lifters, as it typically will allow you to lift more weight. Now, before we look at the actual exercise, let's review some of the muscles that we're going to be targeting throughout the lift. Now, with the squat, we're primarily targeting hip extension and knee extension, where the hips will extend to lift you up from the bottom of the hole and will be primarily done via the glutes and the adductor magnus, as it does play a large role in hip extension. The quads will be the primary component of knee extension. Now, other main areas of this lift, similar to the high bar squat, will be the spinal erectors, the deep abdominals for bracing, as well as the gastroconsolius complex. Now, when looking at the main difference between the high bar and low bar squat, other than the bar placement, the low bar does require significantly more mobility at the shoulder, but it does create less stress on the low back as there is less compression in the lower lumbar spinal disc. This is because the bar placement places greater emphasis on the hips. Now, keep in mind, the squat is composed of mostly big muscle groups, making it very conducive to progressive overloads and should be trained that way with relatively heavy weights between 3 to 8 reps. Now, although there are some exceptions to this rule, just note we typically see compensations in technique as well as decreased muscle activations with lighter loads and heavier reps. Now, let's take a look at what perfect technique should look like. Now, when walking up to the rack, for the first lift, we want to position the rack so it's just above the nipple line. This is going to allow you to safely walk in and out of the rack without hitting those J-hooks. As you approach the bar, you want to use a wider than normal grip, as the forearms will be in approximately 45 degrees. This will allow you to create a bulge in the rear delt as you place the bar just below the spine of the scapula, therefore creating a shelf with the rear delt. This will put the bar in a lower than normal position on the back, and that's actually what gives it its name as the low bar back squat. Now, when doing a low bar squat, the wrist should actually be in a slight flexion position with a thumbless grip, meaning the thumb should be on top of the bar. Now, this is because the hands are used to actually push the bar into the shoulders rather than take any portion of the load. So when looking from the side, you should see the elbows raise as the shoulders will hyperextend to help support that bar and build that shelf. So the cervical, thoracic, and lumbar spine should all remain neutral throughout the entire lift. The pelvis will also be in a neutral position prior to the start, therefore to help with proper bracing. This is going to help set the spine in a neutral position and provide maximal stability. As we continue down, we should see the hips and knees in full extension with the bar over the midfoot. When looking at the foot either from behind or in the front, we should see the heels just slightly wider than shoulder width apart and roughly at about a 15 to 30 degree toe out position. Now note that many lifters that are actually using this technique are competing, and therefore they will use a wider stance and an increased toe out position, as mechanically these levers will allow the athlete to move more weight. So now that we are set up, let's take a look at how we're going to separate the squat into the 3 distinct phases, where we have the descent, the transition, and the ascent. After assuming you are in a good starting position, you should begin the descent by unlocking your hips and pushing them backwards. This is going to allow the knees to remain in the middle toe of the foot while having the bar continue a straight down path over the midfoot. This is going to allow the knee joint, to be the axis of rotation, where little to no movement will occur here in an anterior-posterior direction, allowing movement to occur only around that joint. As the hips sit back, the glutes, adductor magnus, and the quads will all eccentrically load to help you absorb energy as well as protect their respective joints. As the hips come back, we should see the spine angle forward via a bend in the hips. Now, this is completely fine and won't cause any excess stress, as the entire spine should remain neutral throughout the entirety of the lift. When in the bottom of the hole, we want to make sure that we have a tripod stance throughout the foot. There should be equal pressure over the heel, the great toe, and the pinky toe, creating optimal foot stability. Now, as we approach the second phase of the lift, or the bottom of that hole position, you may notice that the shins are in a more vertical angle, okay? Especially relative to the torso, as seen with the high bar squat. Now, this is gonna place significantly less stress on the knees. However, note it does place more emphasis on the hips. This phase is only gonna occur for a moment in time until the final component of the ascent and out of the hole. The first thing you should do is extend your hips, in which your hips will actually move straight up. The knees will remain the axis of rotation, and with the hip joint will move around the knee as the glutes and adductor magnus extend the hip. The knee will actually extend secondary to hip extension. The spine will continue to remain in a neutral position as you continue the ascent, and your hips should actually be the thing that finish the lift by tucking the bar and bringing you back into that starting position.